Lungs. The lungs are vital organs responsible for the exchange of oxygen and carbon dioxide between the air and the bloodstream. Here's a brief overview of their anatomy and how they work. 1. Bronchial tree. The trachea, windpipe, branches into smaller tubes called bronchi, which further divide into bronchioles. These bronchioles end in clusters of tiny air sacs called alveoli. 2. Alveoli. Alveoli are the functional units of the lungs where gas exchange occurs. Oxygen from inhaled air diffuses into the blood, and carbon dioxide, a waste product, diffuses from the blood into the alveoli to be exhaled. Respiration. The process of breathing involves two phases, inhalation and exhalation. During inhalation, the diaphragm and intercostal muscles contract, expanding the chest cavity and creating negative pressure. This draws air into the lungs. During exhalation, these muscles relax, and the lungs passively recoil, pushing air out. Causes of lung cancer. Lung cancer is a malignant growth that originates in the lungs. The primary cause of lung cancer is prolonged exposure to carcinogens, primarily tobacco smoke, but other factors can contribute as well. 1. Tobacco smoke. Cigarette, cigar, and pipe smoke contain numerous carcinogens that damage lung cells over time, leading to mutations that can trigger cancer. 2. Radon gas. Exposure to high levels of radon gas, a naturally occurring radioactive gas that can be found in homes and buildings, is linked to lung cancer. 3. Occupational exposures. Exposure to substances like asbestos, arsenic, diesel exhaust, and certain industrial chemicals can increase the risk of lung cancer, particularly in people working in certain industries. 4. Genetics. Genetic factors can play a role in predisposing individuals to lung cancer. Mutations in certain genes can increase susceptibility. 5. Environmental factors. Air pollution, second-hand smoke, and other environmental pollutants can contribute to lung cancer risk. Other lung diseases and damage. Apart from lung cancer, several other diseases can affect the lungs. 1. Chronic obstructive pulmonary disease, COPD. This term encompasses chronic bronchitis and emphysema, which cause airflow obstruction and breathing difficulties. Smoking is a primary cause of COPD. 2. Asthma, an inflammatory condition where the airways become narrowed, leading to breathing difficulties, wheezing, and coughing. It can be triggered by allergens, exercise, or respiratory infections. 3. Pneumonia, an infection of the lung tissue, often caused by bacteria, viruses, or fungi. It leads to inflammation, fluid buildup, and impaired lung function. 4. Pulmonary fibrosis. In this condition, lung tissue becomes scarred and stiff, leading to difficulty in breathing and reduced oxygen exchange. Lung infections. Various infections, such as tuberculosis, bronchitis, and bronchiolitis, can damage lung tissue and impair respiratory function. Lung injury. Inhalation of toxic substances, lung contusions, blunt trauma, and other injuries can cause damage to lung tissue and impair function. It's important to note that maintaining good lung health is crucial. Avoiding tobacco smoke, staying away from environmental pollutants, exercising regularly, and seeking medical attention for respiratory symptoms are all steps you can take to keep your lungs healthy. Thanks for watching. Please like and share my channel Mind Mentor.